All right, nice ladies and gentlemen. Today we have chapter 21, and this chapter is talking about one of the systems regarding our body. And as you know, we have 11 systems, and this is the only system which is different from female and male. Regarding the other systems, we know that all the systems are the same. Cardiovascular system, respiratory system, digestive system, every system, all systems are the same, except we have here the reproductive system, it is differs. What we have to go regarding this chapter, yesterday we had the PowerPoint presentation for the medical terminology, and we had both male and female reproductive system medical term. Now we are going with our system, which is subject. What is the subject? We need to talk about it. Number one, we need to know that the reproductive system consists of organs. As we mentioned before, any system should be made up of organs, and these organs working together for specific job. What this specific job is capable of accomplish reproduction and creation of new individual. Reproductive organs are the only organs in the human body that differ between male and female, as I told you earlier. And male and female organs develop from same group of embryonic cells. If we are going to into details for embryology, we will notice that how it go up and how it grow up from the bud, and this bud will differentiate it into male and female organs. We need to go after that, the differentiation of organs start in variation of age. So we are going together to know that when the reproductive system of a boy start to grow and start to be differentiated, and when the reproductive system for the girl also start to show up. So let us see here, the sexual organs of female will start to develop at or about the 10th or 11th week of pregnancy. Okay, this will not be the same for male reproductive system. When we reach to the second portion of our lecture, we will find that it differs from female. So for female, sexual organs start to develop by age 10 or 11 week of pregnancy. The ovaries develop from the cortex of the gonads high in the abdomen, which is very important. I need everyone to pay attention to this word, high in the abdomen. Why? Because we noted that in male, that the testes, which is gonads, develop around the level of the kidneys and start to descend down to be at birth in the scrotum for male. If it is failure for descent, this will be a problem, and we have to fix the testes to be in testes. It is very important. You have to remember that the gonads develop high in the abdomen. Very important point. The reproductive organs start to differentiate into male and female, and for the male it will going to be like differentiated from the bud, as I told you, and this bud make a tubercle, and this tubercle will start to make the glans penis, which is the terminal part of the penis in male. Testes develop from the medulla, so this is the difference, different from female. The female develop from the cortex, and for the male develop from the medulla of the gonad high in the abdomen again. So we have a differentiation. We have a point of difference that for female, it is coming from the cortex. From male, it coming from the medulla. All right. Here we have the lateral view for the male reproductive system, and this lateral view is like explaining a lot of issues, like what? If we look here, guys, to this structure, it is very long. You see, this is what we call ejaculatory duct here, and it comes, this is what we call spermatic cord. So this is very vas difference. It is very long. So why it is long and curved to come behind the bladder? Because the testes is actually develop here. If you follow my cursor, actually here the testes develop in the medulla in the abdominal region, and it will descend by time, go down, 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 down to be at birth or shortly after birth. It should be here in the scrotum.
Doctor, I can't see your cursor.
You can't see the cursor?
No.
Me neither.
So maybe this option is not working here. So let us say that this, if you see the scrotum here, and the scrotum is containing the testes, and the testes, as you see, have a long cord. This long cord will join with the urethra and the prostate. So this long cord is due to what? Because the testes develop high in the abdomen. If you look to the top of these slides, you can imagine that this is the higher part of the abdomen. The male sex glands, called testes, begin to develop at 7 or 8 weeks of pregnancy. We mentioned for female, it is 10 to 11. So this means what? The male sex glands start to develop earlier than female. And as you know that the zygote, the question in the exam asking you about the zygote. What is the zygote? The zygote is a fertilized ovum by the sperm. Remember, the definition of zygote, it is fertilized ovum by sperm. And it contains the Y chromosome. As you know, male character is XY. Female character is XX. So this XY, so this Y is responsible for making the gender to be male. What else job for the testes? It is to produce the sperm. So testes produce sperm and the hormone testosterone. And we will talk about the testosterone, what is the job of testosterone actually inside the body. This testosterone aids in maturing sperm and cause many changes related to the development of male secondary sex characters. And we will mention what is the male secondary sex character, like the distribution of hair, beard and mustache, and the muscle bulk, and the voice, and the development of female sex organ. So let us go by the structure of male reproductive system in more details. We mentioned the testes. From the testes, if we go back to the previous slides, we have something coming out, which is the epididymis. Look, guys, this is the testes, and we have here structure around on the top we call the epididymis, and this epididymis has head and body and tail. So this slide is very important to let you know that we have head, body, and tail, and from the tail we will get the spermatic and vas difference and the spermatic cord after that. So the epididymis, sperm mature and the epididymis for about 18 hours, and fluid secreted by the epididymis is to the volume of the ejaculant. So only we have the sperm to be developed, and it should be matured by the time, which is 18 hours. We notice that the male reproductive system is like more secure than female reproductive system. What we mean by secure? As you know, guys, if we expose our body to X-ray, it is not welcomed for female, but no problem if it happened for male. Why? because sperm regeneration and reformation is taking, as you see here, about 18 hours. So if we have sperm exposed to X-ray and it will be like damaged, no problem. It will be like discarded and new sperm will be manufactured after 18 hours. But the problem in female ovum that if she has exposure to X-ray, so all the ovary containing all the ovum and all the ovum will be exposed to X-ray. There is no regeneration. The girl born with a fixed number of ovum, there is no chance to replace or to make new ovum. So this is the hazards. And this is why I'm saying that female reproductive system is not secure much like male reproductive system. After the epididymis, we have another structure which is the vas difference. And the vas difference is a passage way for the sperm and join the epididymis at the ejaculatory duct. And we will see the ejaculatory duct will be so close to the prostate. The seminal vesicle, from the word vesicle, it is a sac, and it is made of convoluted tubules. Convoluted means twisted on itself, convoluted tubules, lying posterior to the bladder. Which bladder? The urinary bladder. And again, I need everyone to pay attention that we have, as a general talk, we say bladder. But actually, in our body, we have two bladder. And one is urinary bladder, and other is gallbladder. The gallbladder is underneath surface of the liver and the right abdominal area. But we are talking roughly as the word bladder, we mean the urinary bladder. And it is empty into ejaculatory duct. From this word, ejaculatory, related to ejaculation. And it secretes fluid, and this fluid is what we call fructose. And as you know, fructose is kind of sugar. If you can remember that we have glucose, we have fructose, we have sucrose, we have maltose, we have lactose. All of these are different forms of sugar. And this one, which is fructose, and this fructose, it is the sugar of the fruit. If you have this background information, fructose is the sugar of the fruit, which provide nourishment for the sperm. The sperm need to be nourished, need energy, need power to move. So this power and this energy comes from this kind of fructose, which is sugar in nature. What about the prostate gland? The prostate gland is specific for male. There is no female gland like this. So it is male. How it looks like? It looks like donut and pyramidal structure. So it is like rounded, but it has tip. So with the urethra extending through it, we call prostatic urethra. So this is the only organ inside our body which is alkaline secretion coming from it. As I told you early in previous lectures, that all the body fluids are acidic, like saliva, like tears, like sweat, like gastric secretion, like vaginal secretion. All of these are acidic in nature. The only one which is alkaline secretion is the prostatic secretion. Why? Because this alkalinity aids sperm motility and mobility and preserves sperm from neutralizing vaginal acidity. We mentioned that the vagina secrete acidic medium. And we mentioned before, when we are going to the lab, we are going to practice for pap smear. And we mentioned that when we are doing pap smear, we check for the acidity of the vagina. And the acidity of the vagina should be around 4. and when we tested by the litmus paper, it should be yellow color. So all of this information are very important, and it is subject of question in your certification exam. The pH of the vagina is acidic, and it is around number 4. And when we tested, it gave us yellow coloration with litmus paper to test the pH. So to neutralize this acidity, and this acidity, of course, for the benefits to minimize infection of the vagina. And yesterday we had the lecture talking about the vagina secretion. If the vagina is inflamed, we call vaginitis. Remember this word. So how to neutralize this media, which is acidic, and give a chance for the sperm to survive? So the prostatics will secrete this alkaline medium to neutralize the acidity of the vagina to give a chance for the sperm to live. Another important glands also secrete substance that aids in sperm movement directly into the urethra and make the normal acidic male urethra. So the male urethra also is acidic, but these bulbourethral glands also neutralize this acidity. As you know, the urethra carry out urine, and urine is acidic. So normally the urethra should be acidic, and we need to preserve the sperm from this acidity because acidity will kill the sperm. So the bulbourethral glands, which is so close to the urethra, it will neutralize this acidity during the act of ejaculation to prevent damage or death of the sperm. After that, we have the male organ, which is the penis. And the penis has important structure, which is erectile tissue. Take care of this name, erectile tissue, because if we have impairment of this erectile tissue due to any reason, so this erectile tissue will lead to a disease which we call impotence. So these 3 columns, if we go into more dissection of slide for the penis, you find that the penis has 3 like this fingers, so 3 like this, and these are erectile tissue. What the job of this erectile tissue is to produce erection during the sexual act. When there is like aroused, the penis become engorged and elongate, and this allows the male to enter to the vagina to deposit the sperm and the semen, of course. So this is the point which we need to know, that erectile tissue are 3 columns, this question in the exam, and how it works. What is the male secondary sex character, which is belong to the hormone testosterone? As you see here, the muscle and the tissue building. Of course, when we look to the girl and to the boy, when they are like mature at the puberty, we noted that there's a difference for the structure and the body build for such kind of male and female. And also testosterone responsible for the development of sex organ like the testes and the penis and the scrotum. And also we noted that boys or men or male are more muscular than female. Also the distribution and the growth of hair, and also the sex desire to the opposite gender. So male, they have a sexual desire or sex desire to the other gender, to female, and vice versa. So this is depend on the testosterone. Sometimes we have people with minimal or the testosterone hormone assay in the blood is not sufficient, and we have to treat them such in case of like maldevelopment, or they don't have enough number of sperm, they don't have like maturity of sexual desire, so they have to receive this hormone under the supervision of the doctor, of course. After that, we need to know what is the component of the sperm, or what, sorry, component of the semen. Semen is the fluid, and this fluid contains the sperm. Fluid from the testes and the epididymis, it is only 5%. Fluid secreted by the seminal vesicle is 30%. Fluid secreted by the prostate gland is 60%. Fluid from the bulbourethral gland is 5%. So, you as a medical assistant, you have to answer this question for your patient. If you have your patient asking you, if I am subject to remove the prostate, is there any changes will affect my sexual life? Of course, this one of the questions you are going to face, or you will hear this question coming from the patient to your provider. So you have to be familiar about what is the changes. As you see, 60% of this amount of semen will be lost. Why? We remove the prostate. So the secretion from the prostate will be lost. And of course, we know that this secretion is alkaline and it is necessary for survival of the sperm. What is the chromosomal analysis and the digital rectal examination? What we mean by the word digital? Digital means finger, digit. Digit means finger. So what we mean by digital, we mean that we are going to examine the prostate for male through approach of the rectum. There is no way to approach or to touch the prostate except you have to examine digitally from the rectal. And when we do rectal examination and we practice on it, how to perform practice rectal examination, digital rectal examination, we call PR. So take care of this abbreviation. PR means per rectum. P for per, R for rectum. So PR, when you are working in such clinic, you will hear that many times. PR, PR, PR. PR means per rectum. So we are going to examine via the rectum. Also, we can do another examination for female. It is PV. What is P? It is per. V means vagina. So PV means per vagina. So examination of female reproductive system through PV. Examination of male prostate, only the prostate, is through PR. What is the chromosomal analysis? We need to know what is the genetic defect that are carried by the sperm. Sometimes we hear that this is like X-linked chromosome, or this is due to trisomy, this is due to disease transmitted by female to male. So we have to make a study of the chromosome. And for the digital rectal examination, we use the word palpation. Palpation means examination by the tips of the fingers. Why we have to examine? To determine the size. Maybe the size, it is enlarged, like in senile enlargement of the prostate, normally. And density, if it is like spongy, it should be spongy. And if it is like hard, it is abnormal. If there is nodule, if there is any tumor, we are going to detect by the PR examination. Do you have any question so far? All right. We are going also to study the hormonal of man or woman. This is very important if we are like doing search to study what is going on for infertility. We need to check if this infertility due to hormonal improper level, and we have to adjust it. Sometimes also we ask for semen analysis, and we have to look for many factors. What we are looking for. If you have a patient and this patient deliver to you semen analysis and ask you, look at it and give me your opinion. So what should you look for? Number of sperm, and maturity, because sometimes we have sperms, they are not mature. As we mentioned that maturity happen after 18 hours. So sometimes we get sample before maturity, so we will find immature sperm. And as you know, immature sperm will be useless. It will not going to fertilize the ovum. Another part we have to look for it, motility. What we mean by motility? Movement. Motile means movement. Sometimes we have the sperm, but the sperm is not moving. So how this sperm can reach the ovum and the outer third of the fallopian tube? If it is not moving, it will be useless. It will be stay in the posterior fornix of the vagina. But if it is motile, and motility will be like prescribed in percentage, so motility is like how much fast, how much speed, how much healthy. So all of these items should be put in your consideration to analyze or to give idea about what is this semen analysis, good or not good. Sometimes we have the semen specimen, but it is like misleading. Like sometimes we have like obstruction of the vas difference. So the testes manufacture sperm, but the sperm is not coming out as ejaculation. So what's the problem? We take biopsy from the testes to see the cells, if the cells are working properly and produce the sperm efficaciously or not. Also, sometimes we have a disease affecting the interstitial cells of the testes. We have to look for it by the biopsy, like we take biopsy, which is sample of the tissue from any other part of the body. So we are going to examine the testicular tissue to determine unexplained cases of infertility, like patient has semen for ejaculation, but this semen contain no sperm. So the problem maybe there is obstruction in the development or the vas difference of the testes. So we take biopsy directly from testes to determine if there is obstruction or not. We learn, you as a medical assistant, how to teach your patient to examine self-examination of the breast in case of female and self-examination of the testes. I will post to you video for how to perform testicular examination, self-testicular examination, because you are going to teach and learn your patient how to perform such examination. And this is very important. Every time the patient has to examine to detect early detection of any testicular cancer, like we learn ladies how to test their breast to develop, to check safety, or if there's any lump can start to show up, we have to deal with it as early as possible. In exam, you have this very common test, which is PSA. P stands for prostate, S for specific, A for antigen. So this blood test used to measure the amount of the antigen present where the prostate hypertrophy. Hypertrophy means getting bigger in size, which may indicate the presence of prostate cancer. So, as you know, guys, nowadays, not like before. Before, it is routine to be done for every patient above the age of 50. But now, so far, there is no family history of cancer of prostate, so the doctor will not order this test. But sometimes the patient asks the doctor to perform such test for him, and this is easy to be done. It is blood sample. So the PSA is very important to determine if there is early cases of cancer prostate, which is very important. We know from yesterday that when we add the word itis, we mean inflammation or infection. So if I have this word epididymitis, it ends by the letter itis. So this means infection, and it is bacterial infection of the epididymis that may spread into the testes, and it is very painful situation. Very painful, and it will lead to swelling in the scrotum along with fever and malaise because it is bacterial infection. There is a fever, and when this happens, especially for kids and in adolescent stage, this will be very painful, and the boy unable to touch the scrotum. It is very painful for him. Even he is not capable to move or sit or to like resist underwear. Very painful condition. As I told you, erectile dysfunction, we know from the medical term the DYS here before the word function means bad or difficult. So this means the function of this erectile tissue is not working. And we call this disease is impotence. It is the inability to have or sustain an erection to complete the intercourse. We have many forms, like primary, the patient has never had any erection before. Secondary, patient cannot currently sustain an erection, but he has before successful erection for intercourse. Another big problem, we find it especially in newly born babies and post-operative, the presence of fluid within the scrotum. Fluid within the scrotum. Fluid we call hydro, but actually it is not water. So any fluid we call hydro, but actually it is not pure water. The presence of excessive amount of fluid within the structure around the testes. So the scrotum will be swollen and it may reach to this big size. Result in enlargement of the scrotum and may occur following injury or inflammation or result of aging, which is very bad sign that if it develop after operation. Prostatic hypertrophy, hyper means excessive, trophy means growing. So it is enlargement of the prostate, and it is commonly happen
Doctor,
over the age
you said trophy means what?
growing, trophy growing.
Thank you.
You're welcome. And this happened, as I told you in the beginning of our lecture, around the age of 50. We have two types. Benign means not serious, not cancer, can result in constriction of the urethra. And this urethra is going from the bladder down to the penile urethra, going through the center of the prostate, which result in incomplete voiding. What we mean by voiding? Passing urine. So incomplete voiding means passing urine. Nocturia, what we mean by the word Nocturia means night urination. Nocturia, noc means night, urea urination. So this is people coming during night. They go frequently to the restroom to empty the bladder. Reduce the force and the size of the urinary stream. So the urinary stream is like the patient come telling you that the stream of urine is not like strong like before, or there is like dripping, and this dripping is due to stricture of the prostate or the swelling of the prostate make apply pressure over the urethra, so the stream is not powerful. Frequent urination. So during our study, I am doing link with you. During our study, we have some words which can be like common between certain disease, like we call frequent urination. And if we translate this into medical term, we call polyuria. You remember? Polyuria. So people with polyuria, maybe if they are male, maybe diabetic, maybe suffer from prostatic hypertrophy. If it is female, of course, this may be due to during the pregnancy, or if she is diabetic also. So frequent urination means multiple, means poly. And maybe the symptoms vary from person to person according to their how they express their illness. We done for the male reproductive system. We are going to discuss female reproductive system next lecture. And for now, it is the time for you to ask. If you have any question, you are so welcome. Let me know, please, what is going on. If you have any concern, if you have any medical issue, you need to talk about it. If you need to clarify certain slides, let me know. It's okay with everyone? All right. I already posted for you this PowerPoint and already posted for you the morning quiz. Go with the portion only for male reproductive system. Tomorrow, God willing, we have a meeting with speaker, and of course they will like take all our time of the lecture. So I will give you a chance to go over this morning quiz, and tomorrow after we're done with the meeting, we are going together to continue the second portion of this lecture for female reproductive system. All right? Any questions?
No, thank you, doctor, so much.
You're welcome, sir. Everything is okay, guys? Malaya is okay? Okay, thank you. Reen, okay? Charlie, okay? Okay, I noticed Amy joined us. I hope she is okay.
She's got an appointment right now, but she didn't want to have
Yes, she told me, but she sent me a lecture that, she sent me a text message. She was listening with us during the lecture, and now her turn to be examined by the doctor. So she has excused, and we wish her fast cure, of course. I wish everyone wonderful the rest of the day, and see you tomorrow, 10 a.m. We need to be like, as you see, we have a message through the email, and this email is sent to you regarding how we looks like during the meeting. So be careful to be professional, be careful to be ready on time, because the guest speaker will join us at 10:15. Okay? So far, I wish everyone to be safe. Enjoy the rest of the day. Bye-bye.
Have a wonderful day.
You too,
Thank you,
sir.
doctor.
You're welcome. Bye-bye. You're welcome. Bye-bye. Bye-bye. Bye.